Hello everyone, welcome back to Neuroanatomy sessions, and I'm Dr. Rajita, faculty of Next Fellow. And in previous session we have seen learning about the spinal cord and to three parts, and now we shall start the brain stem. We are ascending up from the spinal cord to the brain stem, and brain stem we again divide into three parts: medulla as the lower part, then pons, then we reach the midbrain, the three parts of brain stem. So today's topic is on medulla. So brainstem, we know that it is a stalk-like part of the brain which connects the spinal cord to the forebrain, and which extends from the posterior commissure to the lower part of pyramidal decussation. So lower part of pyramidal decussation, above that it is considered as brainstem, that is present just above the foramen magnum. So here we can see this is midbrain, pons, medulla. So midbrain mediates the visual and auditory reflexes, and it contains the nuclei of third and fourth cranial nerves. Midbrain contains third and fourth cranial nerves, and we know the brainstem begins at the level of cerebral peduncles anteriorly, and corpora quadrigemina or quadrigeminal plate or tectal plate on the posterior side. So this is the cerebral peduncle, and this is the tectum or corpora quadrigemina, and you can see the thin canal traversing through the midbrain, which is called as cerebral aqueduct or aqueduct of Sylvius. So this small wedge-like part is the midbrain, and then it continues to form the pons, and the pons is bridge which connects the midbrain to the caudal myelencephalon, that is the spinal cord and medulla. So that is the reason it is called pons. And brainstem serves as a passage for ascending and descending tracts as well. So it is the gateway for all ascending and descending tracts, and it contains all vital centers which controls the heart rate, respiratory rate. So the compression of this brainstem is results death. Often it is fatal because it contains the all vital centers like heart, cardiac center, respiratory center, and so on. And it is the center for reticular activating system which controls the sleep and wakeful cycle. That is, our circadian rhythm is also under the control of brainstem. And last 10 cranial nerves, that is third and fourth, we know they are getting origin from the midbrain, and fifth gains its origin from the pons, and 6th, 7th, 8th gets originated from the pontomedullary junction, and 9th to 12th gets origin from the medulla. So that was the overall features of brainstem. So here we can see the ventral side of the brain, where we can also appreciate cerebellum and ventral surface of cerebrum, and we can see the interpeduncular fossa as well here. This is the optic chiasma, optic tract, and here is the stalk of the pituitary gland, mammillary bodies which are the part of hypothalamus. This is the midbrain here, which are the crus cerebri, cerebral peduncles of midbrain, and this is the perforated substance, posterior perforated substance we can see here, and we can see the upper border of the pons forming a boundary of interpeduncular fossa. This is pons. This groove is the basilar groove where basilar artery passes through. This is pontomedullary junction, and here is the medulla. So our topic is on medulla. So first we shall finish off the external features of medulla. It is a truncated cone. You can see here, this is the specimen same. So it is a truncated cone which is bulb like. So nuclei in the medulla are also called bulbar nuclei, and the tracts ending up in the medulla are called corticobulbar tracts, and any paralysis due to the compression of these nuclei are called as bulbar paralysis. So they are the terms which are associated with the medulla, because medulla looks like a bulb. And this medulla, we saw previously, it is present in the posterior cranial fossa, and we know it is the lowest part of the brain stem, which continues as the spinal cord below the level of foramen magnum. And last 9th to 12th cranial nerves gets origin from the medulla. So it contains autonomic centers that regulate circulation, that is the blood circulation, and respiration, and also the gastrointestinal activity. It contains the centers for swallowing, sneezing, coughing, and vomiting. And it is connected to the cerebellum. We can see here the medulla is connected to the cerebellum on each side via the inferior cerebellar peduncles. And this groove is the ventral side of the brain or anterior side of the medulla. This is the anterior median fissure, which continues as anterior median fissure of spinal cord. These two columns on each side are the pyramids. They are the pyramids, and lower part of the pyramids, they undergo decussate, which is called pyramidal decussation. And lateral to the pyramids in the upper part of medulla, we can see ventrally an elevation which is called as olive. Deep to olive, there is a nucleus called inferior olivary nucleus, and lateral to the inferior olivary nucleus, this is the inferior cerebellar peduncle connecting medulla to the cerebellum. And the groove which is between the pyramid and the olive, this is called as anterolateral sulcus, and the groove between the olive and the inferior cerebellar peduncle is called posterolateral sulcus. From the anterolateral sulcus, hypoglossal nerve gains its origin, whereas the posterolateral sulcus gives rise to that is 9th, 10th, 11th. That is 9th is glossopharyngeal, 10th is vagus, and 11th is spinal accessory nerves. So these are the features which we appreciate on the ventral surface or the anterior side of the medulla. Next, we shall understand the posterior side. Here is the brain stem showing the posterior side of the brain, little lateral view it is. So we can see the midbrain, this is midbrain. This is pons, dorsal side of pons. This is the upper part of medulla, which is the open part of medulla. The lower half is called closed part of medulla. Dorsal surface, you can differentiate into upper half into open half, which forms the floor of fourth ventricle, and lower half is the closed part. Upper open part forms the lower part of floor of fourth ventricle, and the lower part closed part encloses the central canal, which continues as the central canal of the spinal cord. Closed part exhibits three longitudinal elevations. You can see the three longitudinal elevations. So this one is the gracile tractus gracilis or gracile fasciculus, which contains the gracile tract or tract of Gall, which we saw in the posterior column of the spinal cord. Same thing continues and ends up here by forming an elevation which is called as gracile tubercle. Similarly, the cuneate fasciculus or tractus cuneatus ends up here an elevation called as cuneate tubercle, deep to which cuneate nucleus is there, here deep to which gracile nucleus is located. And lateral most is the lateral most elevation is the inferior cerebellar peduncle. Inferior cerebellar peduncle. So these are the features which we can see on the closed part. Open part forms the lower part of floor of fourth ventricle, which contains hypoglossal triangle, vagal triangle, and vestibular area. And this transversely running fibers are called stria, which separates the upper open part of pons, dorsal side of pons, from the dorsal side of medulla. So here is an image showing the fourth ventricle. This is midbrain. These are the four elevations of midbrain. This is cerebellum. The section is taken along the vermis of the cerebellum. So we know the gap between the cerebellum and the brainstem is fourth ventricle. So this is the floor of fourth ventricle. So that was about the external features of medulla, both on ventral and the dorsal side. And now we shall continue with the internal structure. Internal structure, we can divide the medullary sections, one at the level of lower part of medulla at the level of pyramidal decussation, then in midway of medulla, that is below the level of olives, where the sensory fibers decussate, called sensory decussation, and the upper part is at the level of olive, uppermost part that is at the level of pontomedullary junction. So these are the four sections which are makes us to understand the internal features of medulla. So starting with the pyramidal decussation, so this is the anterior side, ventral side, this is the posterior side of medulla. We can see the pyramids, they get cross to form this decussation, which is pyramidal decussation. Externally also this crossover is seen usually within the anterior median fissure. And after crossing, I said 75 to 80% fibers gets crossover, and after crossing they form a track here which is called as lateral corticospinal tract. So pyramidal decussation is most important feature in the lower part of medulla. And because of this fibers crossing over, the gray matter here we can see it is similar to spinal cord having central gray matter and peripheral white matter. Gray matter, it is differentiated, it's separated into an anterior detached part. This is the detached anterior horn from the central gray matter, and we can see the central canal. And posteriorly this is the nucleus gracilis and laterally nucleus cuneatus, lateral to it spinal nucleus of trigeminal nerve. This one is the tractus gracilis, tractus cuneatus, and then tract of, that is the spinal tract of trigeminal nerve. So these are the nuclei which are the sensory part, posterior sensory column. And we can see laterally spinocerebellar tracts which are descending tracts. Sorry, they are the ascending tracts, spinocerebellar, spinocerebellar ascending tracts. Then lateral spinothalamic tract, this is the lateral spinothalamic, from spinal cord to thalamic ascending tracts. So, and also we can appreciate the reticular formation which we see all through the length of the brainstem. So these are the important features what we see in the pyramidal decussation. Here the middle of the medulla, the cut section is taken in the middle of the medulla, where the nucleus from the nerve fibers from the nucleus gracilis, nucleus gracilis, nucleus cuneatus, they cross and they go. So this decussation is called internal sensory decussation, and these fibers are called internal arcuate fibers because they are not seen externally. And after crossing over, the track which is present is called as medial lemniscus. It is present on the medial side in the midline, near the midline. So medial lemniscus, which is present all through the length of the brainstem after they formed. So once they form in the middle of the medulla, it is seen till the level of midbrain, because this medial lemniscus after forming they ascend up and they end up in the thalamus. And here the central gray matter is reduced to small area around the central canal, which is called central gray matter. And mainly we can appreciate hypoglossal nerve nucleus, which gives rise to hypoglossal nerve, and nucleus of vagus, dorsal nucleus of vagus, and for taste sensation, nucleus of tractus solitarius. They are located around the central canal. And the inferior olivary nucleus is partly seen here. That is the reason it is not making any elevation. Little lower part is seen. So the section is taken at the lowermost part of inferior olivary nucleus, and rest of it is same here. The pyramidal decussation is not yet happened. Pyramidal decussation, we know it happens in the lower part of medulla. So they are the tracts present here. So the pyramidal or corticospinal tracts we will be seeing even in the midbrain and pons as well. Next, about the internal features of the medulla at the upper part, that is at the level of olive, that is the inferior olivary nucleus. So this crenated bag-like appearance, what we see is the inferior olivary nucleus, which is an important feature here. And we know we are having medial lemniscus. So we are having the medial lemniscus here already formed, and we also have the medial longitudinal bundle, also called MLF, the medial longitudinal fasciculus. This is the medial longitudinal fasciculus. Medial longitudinal fasciculus is an interconnecting bundle which connects the that is cranial nuclei, that is 6th cranial, 4th cranial, 3rd cranial, and even the 11th cranial nerve nuclei. All these cranial nerve nuclei are interconnected with each other for proper coordination by means of MLF, medial longitudinal fasciculus. So when you hear a loud sound, automatically you will turn your head, that is your 11th cranial nerve is activated. Your eyes will move, that is because 3rd, 4th and 6th cranial nerve supply the extraocular muscles, and hearing, vestibulocochlear nerve. So all are interconnected with each other by MLF. And we already saw the formation of medial lemniscus here, which is there after for crossing over, which we saw just in previous image. And we can see the cut sections of inferior cerebellar peduncles also. And here this is the open part of medulla, so which forms the floor of 4th ventricle. So where we can see the hypoglossal triangle here contains and makes contains a nucleus called hypoglossal nerve nucleus. Then vagal triangle of the floor of 4th ventricle contains vagal nerve nucleus like dorsal nucleus of vagus, nucleus of tractus solitarius, then nucleus ambiguus, and lateral most nuclei will be the vestibular nuclei, medial and lateral vestibular and cochlear nuclei. Vestibular nuclei are mainly seen in the olivary nucleus. Cochlear nuclei are mainly appreciated at pontomedullary junction. And remaining things are the same thing. We can see the arcuate nucleus also here, which are the descendant pontine nuclei from the pons, present only in the upper part of medulla, called as arcuate nucleus, surrounding the pyramids. This is at the pontomedullary junction. The cross section of the medulla at the pontomedullary junction, that is the distribution of grey matter, is similar to that of inferior olivary level, except the inferior vestibular nuclei is replaced by lateral vestibular nuclei at this level, and cochlear nuclei are seen at this level. So laterally we appreciate the cochlear nuclei, which are not seen at the level of olives, and the remaining things are the same, and white matter is analogous with the inferior olivary level. And arterial supply, the vasculature of the medulla is bit complex, and it is dependent on the level which is being viewed. So vasculature here we can see this is the base of the brain demonstrating circle of Willis. So we can see the two vertebral arteries joining to form basilar. Basilar terminally divides into posterior cerebral arteries. Before forming posterior cerebral, we can see superior cerebellar arteries, pontine arteries, and we can also appreciate posterior inferior cerebellar arteries and anterior inferior cerebellar and labyrinthine arteries. So this is the lower part. We can see the basilar artery, two vertebral arteries. We can see the formation of anterior spinal artery as well. And this is the anterior inferior cerebellar artery and superior cerebellar artery and basilar artery. Posterior inferior cerebellar artery is given off from the vertebral artery. Usually it is given off from the vertebral artery. So the vasculature of medulla, I said already, it is little bit complex and it is dependent on each level of medulla being viewed, and vessels that supply the medulla are mainly the anterior spinal artery. So anterior spinal artery is here, which is not labeled. Anterior spinal arteries, posterior spinal arteries, which are given off from pica, posterior inferior cerebellar arteries, and also the vertebral artery directly gives rise to, and also the anterior inferior cerebellar arteries. So here is the beautiful image for us to understand the blood supply of medulla at each level. So here is, this is the lower part of medulla at the level of pyramidal decussation. This is at the level of sensory decussation, that is medial lemniscus decussation. This is at the level of olive, where the open part of medulla, that is the upper part of medulla. In the lower part of medulla, first we will see what is common. So this blue color is common in all three levels, that is anterior spinal artery. So anterior spinal artery supplies all through the length of medulla oblongata. It is clear. Next, the yellow one. Yellow one is also there all three levels of medulla, which supplies the lateral part. So vertebral artery supplies the lateral part of medulla. That is also all three levels. The posterior part, the blood supply is different. Please note here. So the lower part of medulla, posterior spinal artery supplies the posterior part. Middle part of medulla, posterior spinal artery and posterior inferior. This purple one is posterior inferior cerebellar arteries. So both the arteries supplies the middle part, and upper part of medulla, it's supplied by the only posterior inferior cerebellar artery. There is no posterior spinal artery over here. So that is the three levels of medulla blood supply. So any damage to posterior inferior cerebellar and vertebral artery, so the lateral part will be getting affected, which is called as lateral medullary syndrome. So if there is a blockage of anterior spinal artery, the anterior and medial part will be affected, which results in medial medullary syndrome. So there are two vascular lesions. One is the anterior, that is the medial medullary syndrome, and lateral medullary syndrome. So medial medullary syndrome, so here we can see the symptoms. It is also called Dejerine syndrome. There will be opposite half of paralysis, that is called contralateral hemiplegia, because pyramids are affected in the midline, and contralateral anesthesia, medial lemniscus. So opposite half loss of senses will be there because the medial lemniscus is affected, and even the hypoglossal nerve nucleus and nerve is involved, so the tongue is deviated to the side of lesion, and it is also associated with Horner's syndrome. The structures involved: 12th cranial nerve, corticospinal tract, and medial lemniscus, not or, sorry, and medial lemniscus. Next, about the lateral medullary syndrome, which is called as Wallenberg syndrome. The symptoms are lateral side vestibular nuclei are affected. So there will be inferior cerebellar peduncle is involved, ataxia, dysphagia, dysarthria because nucleus ambiguous is affected, contralateral analgesia of the body, lateral spinothalamic tract, and ipsilateral loss of pain and temperature of face, that is the spinal nucleus of trigeminal nerve. So here we can see the lateral medullary syndrome, what are the structures are affected: vestibular nucleus, so there will be ataxia, okay, loss of balance, and also the inferior cerebellar, and the spinal tract of trigeminal nerve, so there will be pain and temperature on face, ipsilateral same side, then nucleus of ambiguous, dysarthria and dysphagia, so there will be hoarseness of voice, and dysphagia, not able to swallow. So here you can remember a small abbreviation: nucleus ambiguous effects are specific to posterior inferior cerebellar artery. So this here the abbreviation is don't pick a horse that can't eat, means pick is pica, posterior inferior, horse means hoarseness of voice, can't eat means dysphagia. So this is how you can remember lateral medullary syndrome. So that's how we completed medulla today with both external features, internal features, blood supply and clinical aspects. Thank you.